the contractor who was supposed to do the projects. I've written more than 5 letters. We have engaged and met several occasions. Promises upon promises will make me go and tell the public that the contractor is ready and is mobilizing to site in the next 2 weeks. That never happened. The Minister of Finance insisted on the value for money audit to check on how much money had been spent on the projects. Because on assessment, you could realize that if you compare money left sitting down as balance in the account and work left undone, you could easily see that the money couldn't complete the projects. So there was a need for some audit to be done. That audit took some time because of documentation that the auditors needed, and the contractor had unwillingness to actually submit these documents in good time. When the report was submitted, we were advised to determine the contract. There were issues in there. I went back to finance to insist that determining the contract will mean another 6 months to be able to do the litigation issues and re-awarding. But we wanted the project to complete. So they should allow us to go ahead and allow the contractor to work whilst we talked on the site to resolve issues that had come up in the report. I got a hearing. We submitted all documentation to Attorney General's office for advice. They asked us to engage the contractor to do 3 of the projects that had advanced in relation to works to be done. And the rest, we should sit down there, and whilst they come on site to complete the 3, we talk about these. The contractor assured us we'll be moving to site. We were demanding certain things to be done. The initial thing was him to mobilize to site to look at dilapidation assessment. That was done. Got a report. We sat down with it. We agreed on what we should do. He gave us how much we need to complete the work. On our assessment, we also gave an estimate. So it's like we were not agreeing at one stage. Even that, we insisted and asked him to come and start work whilst we talk about the difference that was sitting between the 2 parties. We didn't get any serious hearing from the contractor. We asked him to give us bills of quantities to completion. After some time, he sent us a note that he couldn't submit the bills of quantities. Even that, because we wanted to complete the projects, we said to the contractor to mobilize to site, and whilst there, we together will assess and get the proper bills of quantities to guide us in project implementation. In course of this year, after waiting and not hearing any good news from the contractor, I wrote a letter to signal our notice of intention to determine the contract. The response that came wasn't very good to us. That meaning we didn't have any other option than to write to Attorney General's office for advice to determine the contract. We are waiting for the last meeting at the EMT for us to know where we should go. But we have decided to actually determine the contract, look for another contractor who has capacity to come in to try to do the work for us as quickly as possible. And we believe that if we're able to jump this hurdle, we might complete these full 2 projects before the end of the year. So nothing has been abandoned. I've talked about University of Ghana Medical Center Phase 2, which is virtually completed, and some operationalization is there. The intensive care unit of that place has been dedicated as a treatment center for COVID patients. And as I speak, there are people in there receiving treatment in that place. Construction of 5 district hospitals in Sola, Tolon, Sumenya, Bupe, and Weta, and the polyclinic in Bamboy. All these projects are ongoing. Contractor is seriously on site and they are working to complete for us. Overall, the projects are between 45 to 65% completion. I have visited Weta and I know what is there and I know what I'm talking about. Weta is in Volta region. Construction of 5 and upgrading of 1 public health facilities in the western region. Akontomra Elubo, Bogoso Mpoho, Nsayem Wasedunkwa. I did the sword cutting for 5 of these projects sometime last year. There were a little bit of problems, the contractor and the funding agency, but as I speak, all the contracts, the subcontractors are on site, they are mobilized, and work is actually progressing without any serious challenges any longer. Completion and equipping of Bekwai District Hospital. This was a project that was started at Kwame Nkrumah's time, post independence. There were challenges, so government at the time abandoned that place. President Kufuor's time, that place was picked up to do Takwa and, what is that place that we did the other one? Is it Takwa? Yes, Takwa and Bekwai. Fortunately, Takwa got completed, but after Kufuor's exit, Bekwai was again abandoned. 2017, we started working on how we can get Bekwai done. There were a bit of problems, but we managed to resolve the problems. And last year, 2019, I went personally to commission, cut the salt to restart Bekwai. We are getting close to completion. And last week, when the president met the Ghana Medical Association, fortunately for us, the vice president of the association is now the medical superintendent of the Bekwai Hospital. He said to us confidently that some places have been completed to the extent that we can use 1 block as a treatment center to fight the COVID battle. So we are fixing the place now to dedicate it as a treatment center to add on to the few places we have in Ashanti region. So we are on course. Modernization and equipment of 4 selected facilities. These are all in Eastern region. Tete Kwashi Memorial Hospital, Chebi District Hospital, Aburi, and Atibi hospitals. Again, I went to do the sword cutting for all these projects. The contractor is on site, on all 4 sites, and work is progressing steadily. We have managed to actually start to complete 15 chip compounds in the first instance, located in different parts of the country. Then another package of 26 chip compounds. We are expecting that all these 16 plus 26 will be commissioned this year for use. Apart from these, when we realized that we are about completing all works that were ongoing before we came in, we started working, apart from the chip compounds that we have done. We have rescheduled the rehabilitation of Bolga Regional Hospital Phase 2. And was it last 3 weeks or so? We completed all arrangements and the contractor has mobilized to site to complete that work. We are in the process of completing procurement processes for equipment to be brought to actually complete the Wa Regional Hospital Phase 2. Completion and equipping of Komfanochi Teaching Hospital Maternity and Children's Block. This place has been left undone for close to 40 years. We have now completed almost every exercise. Immediately, restrictions on gathering, public gathering, is removed. We will see sword cutting at Komfanochi to actually begin to complete the old time maternity block that have been left undone over several years. We have scheduled and got parliamentary approval. As I speak today, we are negotiating on the value for money report with the contractor, and soon we will mobilize, contractor will mobilize for us to do short cutting to start construction of Koforidua Regional Hospital. We have scheduled to do district hospitals at Obuasi, a trauma hospital at Enyinam, and rehabilitation of the NUNC government hospital. This is part of our program for this year and next year. We've also got parliamentary approval, and we are about finishing details that we can do to enable contractors that have been selected with funding to go to do Shama Hospital project and La General Hospital. Whoever passes on the beach road, if you see La General Hospital on the right side, just be a little bit inquisitive and go in there and look at what is sitting there as a general hospital. Structurally, that place shouldn't be habitated. Engineers have given us indication that that place can come down any day. So we took a bold step to try to change the face of that place. In fact, the medical superintendent there has been relocated to Ga East. So that place is virtually going to be empty to enable us pull down and build an ultra-modern high-rise hospital facility at that same grounds. Because of space, we can only build into the sky. All arrangements have been done, cabinet has approved, parliament has approved. We are now working with the contractor to actually begin implementation. We have again scheduled to construct the Urology and Nephrology Center of Excellence at Kolebu Teaching Hospital. Again, we've got cabinet and parliamentary approval. We are just tying knots to enable the contractor mobilize to site. This will complete in 2022. Again, we have scheduled and got parliamentary and cabinet approvals to do the completion of a new 330 beds maternity block at Kolebu Teaching Hospital. This project is also expected to complete in 2022. Tema General Hospital has been scheduled for a new look. So we are going to construct Tema General Hospital as well as central medical stores and the rehabilitation of 2 district hospitals at Nkranza and Doma. We have also got cabinet and parliamentary approvals to do 12 hospitals in Eastern Ashanti, Ahafo, and Greater Accra. Places like Jumapo, Kwabeng, Nkwatia, Adukrum, Achiasi, Suame, Robonso, Sabronum, Manson Kwanta, Pedie, Mem, and Ponkatamanso. We've got approvals, sources of funding ready. We are only waiting to complete documentation to enable the contractor move to sites to do all these projects. We are working to source funding now to do Rage Phase 2 to give the place the look that it needs to have. Contractor has already been selected. We are tying knots to get documentation to go to cabinet for approval, and again we'll follow up to parliament. We have also selected to do 22 district hospitals even before the president's announcement, when we got indication of an allocation or some portion of the Sino Hydro facility that government was arranging to take. So we listed 22 districts with our hospitals to do. If you have completed all arrangements and engagement with the Sando Hydro project, by now, 22 district hospitals will have been started. So the president is not talking out of nothing. We needed to complete what we came to meet. Whilst we planned to do our own, we couldn't have left all the 10 in East Central, 5 in Greater Accra, about 4 in Ashanti, and some other places. But when we worked and realized that, yes, we have done a lot, we also need to leave legacy. We started moving into our own area. And if you have listened very carefully about what I have done, it's a clear indication that the president has a vision and the government has a plan. So now that he has mentioned the entire 88, how did he come by the 88? We were working already, but on the quiet. And with the outbreak of this pandemic, the president also charged us to start looking at treatment centers across the country for infectious diseases. Even there, we have awarded some contracts that I may start visiting for Ghanaians, our people, to see how the president thinks and what instructions he gives us and how we also work with these instructions. So we are working on getting comprehensive treatment centers in places like Sewua, Zebila, Pantan, Dodua, and Asanrienso, Goso, Cape Coast, Kolebu Teaching Hospital again. That has actually started. And there are 2 small facilities, one good one in Kolebu, and the previous unit rehabilitation again in Kolebu. Takoradi, Nalerugu, and Sunyani as well. So these are things that to make us strengthen some part of our health system. But if we have got all this complement of massive infrastructure coming, I think the president should have confidence to announce to the nation that he's going to do 88 district hospitals. We knew what was there already. And he can't think that we go through this pandemic and our health system will continue to be as we sit here. So that is his vision.
And the national information sessions, about 13 local languages, are available on the Ministry of Information's Facebook page. About 13 local languages. We want to ask media across the country, pick whichever is relevant for your local market and do well to help us spread the word there. About 13 local languages. They're all available on the Ministry of Information's Facebook handle. At this juncture, for those who have questions, please show by hand and step forward. We'll take them in batches of 3. 1, 2, 3. Yes, sir. And then we'll come for the second batch. Social distancing observed. Yes, sir, go ahead.
My name is Joseph Akabla. I work with Joy News. The first question, I realized that you relied on the gains made in the economy since 2017, as well as what has been done with regards to the COVID support programs to citizens as a basis to say that the economy can afford what the president intends to do. I want to ask whether we should not be looking at figures first and foremost as to how much these programs will be costing. So I want to find out whether we've put at least an initial figure to it even before we get there.
You are talking about the 88 hospitals.
88 district hospitals, yes.
I think it's understood. You would notice that our presentation has been about the whole gamut of interventions.
Yes.
So you are asking about the 88 specific.
88 hospitals.
We'll get to the answer. So figures for the 88.
Yes, the other issue relates to the case count. I realize that for some of the regions, the numbers remain the same. And I'm just asking generally because of reports of people who were tested positive, who had escaped mandatory quarantine or who had been asked to isolate, who had refused. But we've not received any confirmation from the health service that those people have been found.
So you're asking whether they are included in the numbers as have been presented, or they are not included in the numbers?
Because if you have 10 in a region and one person is on the run, obviously keeping a number at 10, I'm not too sure, or whether indeed.
No, but then that means your case count is 10.
Yes, and so I'm asking whether they have been found yet, or we are still after.
Okay, no, so let me see if I understand. Your question is that for those who are reported to have escaped, have they been found yet?
That's the question.
Or is your question that are they included in this one?
Whether they have been
okay, found. So Ghana Health Service have those, and when you say those who've escaped, which one are you talking about?
The northern region, and also...
Okay. This is the one Guinean lady, right?
Yes, yes.
Okay.
And also in Accra, we reported a Fadama incident. There were 2 people. One was apprehended. The other is also... the last report we put out was that the person was still on the run.
Okay, so the Guinean lady and 2 from Fadama, have they been taken in? Are they part of those you have in your containment system?
Yes.
You give a provider.
And just a final one for the Works and Housing Minister. I mean, the other briefings that we had, there's a bit of a support program like electricity and water.
Yes.
Other places, in fact, we've heard some landlords who have gone a step further to give some free means of accommodation to their tenants because of the situation we find ourselves in. I want to find out whether his ministry and government, for that matter, is considering such a support program, possibly one that will be specially tailored for the Ghanaian.
A support program on rent.
On rent, because there are people who are saying that they are not working, but their rent is due and they need some help.
Yeah, I think it's understood. Honorable Minister, are you considering a support program on rent? We'll come to you to give us an answer.
And finally, he talked about the foreigners and not advising that you shouldn't rent out facilities unless you are sure that they are COVID-free. I'm asking about how about Ghanaians as well, because the statistics we have currently actually shows that community spreading is more than the imported cases that we have.
Minister, I'll come to you to respond to that. Yes, please.
All right. Thank you very much. My name is Selo Amenya. I work with TV3. I would want to start with the health minister. He said that no project has been abandoned, but I wanted to find out about the police hospital. Since 2016, we've not seen anything ongoing.
You mean
there.
Police hospital in Accra?
Yes, in Accra.
You are suggesting that since 2016?
Yes, we've not seen any works being done there.
So
if you can update us on that.
No works on police hospital in Accra since 2016?
Yes. And also, we've been asked to wear face masks for a good reason. I want to know what is the implementation plan. Are we also going to see a task force in town ensuring that everybody, because we still have people roaming in town.
So how do we plan to enforce the order on face masks?
Yes.
Thank you. May I ask that we keep the questions snappy so that we can quickly. So how will we enforce the orders on face masks? Next one.
I'm Kujajman, CTTV.
Hi, Kujo, let's hear you.
I have 3 sets of questions for the Works and Housing Minister and then 3 for the Director General of the Ghana Health Service. Works and Housing Minister, when you were giving the amount of money we've spent on flood control programs and drainage works, when you got to 2016, you said 12 million was spent, right? 12 million Ghana cedis. 227. Okay. 2016, and then you said that 136 million for 2017 for the. So what accounted for that huge jump from the 2016 figure and the 2017, and also how will the ministry ensure that landlords adhere to these measures that you have put in place? And my last question would be for the residents around Dansoman Beach area and then Glife, the sea defense project exercise there has been stalled. I mean, we are in COVID-19 era. What is being done to make sure that project comes back on stream? For the health director, the Ghana Health Service Director, please, are there any new deaths? And then how much? We were told the other time that we have 18,000 backlogs more. Have we tested, have we been able to overcome this backlog of testing exercises? And then there are some discrepancies between the regional results that we are getting on the website. For example, the Bolga, regional, the data from Bolga did not correspond with the one on the Ghana Health Services website.
When you say data from Bolga, please help us a bit. What do you mean?
In terms of the information management data, yesterday the health director there issued a statement, and the numbers in there did not correspond with what was on the Ghana Health Service website.
So there's a discrepancy between the
regional.
A statement issued by the regional health director.
Yes, please.
And what is reported on the national website.
Yes, please.
Okay, so that's a specific instance.
Yes, please.
Bolga, you say?
Yeah. Thank you very much.
Okay, Bolga and Accra difference. Please make a note of it.
But
Final one. Yeah, Kwame Tio.
TV Africa. My son Bisano, health minister. No. But some bisa question on chief compound. Be busumi you know me ko story be wo domain samperman e wa masaman chief compound be our mampani ko for so me see 2000 me no ka say
2000
me no ka say empire na agi da na fa
Pachoko echi wo say chiefs compound be a
o mampani see no 2000 no see the year 2000 no mo see
okay
me no ka say empire na agi e dan ma fa be busumi no na me ko yes our story no. After maybe some questions so la general hospital.
There is a question no. Change na boy kakra. Chips compound be a yesi no 2000. Sabri abandoned.
Abandoned.
Okay.
Empire na agi.
Ewo infa.
Domi samperman.
Domi.
Amasaman.
Okay.
La general hospital. Person be bisa ono aka be say parliament approve funding. Person me bisa say fund no say no mo de ehim na ebe wie da ben afi Eugene University of Ghana hospital no o kire bibi say omugusa ka phase 1 on be wie na say sika na
o ka phase 1 no I'm say phase 2 no kind of
okay
because phase 1 there's so many
also ka phase 2 na then na phase 2 no mu hwe na enwi ansa na abano asa e de nsa kan different project bi
because say phase 2 of UGMC no yenwie ya aban any sort nsa kan be before
I think senka no etimi wi ansa na e
aban de nsa kan be before
different project bi so
that's it. Okay, Minister, I will come to you to respond to that. Health Minister, please be on standby. Ghana Health Service, be on standby. Works and Housing, please be on standby. Ghana Health Service, before I come to Health Minister. So you give me a few minutes. Let me respond to the first question. So I'm sure you heard us make the point that a strong economy, a resilient economy is a foundation for affording all the interventions that we've been talking about. The ones that we have done, which we have paid for, the ones that we are paying for, the ones that we have been tasked to work on. The common denominator is a strong and a resilient economy. If you don't have it, you can't even afford all of these things. And what we are saying is that it is because of the improved nature of the economy. That's how come you've managed to afford all the things we've done so far. That same denominator is what will go for what is outstanding by the time they are done with their calibrations and giving us that figure. You recall that we have mentioned that the president has tasked them to complete or to sync the 22 and the rest he was talking about with the broader envelope of 88 and advise the entire country. What we are saying is that the reason for which you should have confidence that all of that which we started about 8 weeks ago till then is affordable is because we have a strong and a resilient economy that has improved from where we all collectively were at a particular point in time. And when they are done with these numbers, what is outstanding, they will also let us know. Minister for Works and Housing, come, let's take yours out of the way, and then we'll deal with Ghana Health Service and Health Ministry.
Let me attempt to answer the question relating to rent support, and clearly that is the voice of former President Mahama, that we should try and look into situations of giving rent support to those who are without any good place of abode. I want to refer to the 2020 budget. If you pay regard to paragraph 12, and I'd like to read, Mr. Speaker, if you add the cost of cleaning, if you add the cost of cleaning, the financial sector challenges to the long list of legacy bills that the Akufo-Addo government had to settle, the cost to the Ghanaian payer is around 33 billion Ghana cedis. So you can see that is all financial space. The debt was 33 billion. You know, the president has had to deal with the situation because he has a very large heart and a generous heart. So free water, some people will take it for granted. There's a cost implication. Electricity, you could see we couldn't go the full hog of making electricity free because of the high cost of generating electricity. And if somebody should push that people who have no place to live, as a direct result of the COVID-19 challenges, should have their rent paid, we should be able to absorb it if we have the financial space. But the first instance is that report any landlord, and for that matter, a landlady, who want to exploit these circumstances to the rent control offices, and they'll be dealt with. So I have not heard of a wholesale eviction of tenants, which will warrant that we should immediately come to their aid. If there is any situation like that, we'll get a feedback from the rent control offices and we'll handle it. But let's see if there are numbers like that. We shouldn't just wave our hands and say that we should pay for the rents of people who are suffering as a result of the COVID-19 challenges. But if we see the numbers, we will see what we can do. But it's all as a direct result of what we can do given the financial space. So that is the first question. The second question was a bit complicated. It was trying to compare the allotments for flood control challenges and concrete lining challenges of 2016 and 2017. I think I gave the figures and I was a bit concerned what was he trying to communicate. I couldn't get the import of the question. But if you want to have the figures again, can I have the figures? I'll give it to you. Yes. The figures are here. Relating to National Flood Control Program and other drainage projects, for 2016, the sum of 12,271,558 Ghana cedis was spent. If you want to know what was spent in 2017, it's in the sum of 8,136 and then 18.41 Ghana cedis. And if you want to know the biggest boost in that area, is what happened in 2018. 220,584,188.69. My attention has been brought to the fact that the sea defense undertaking at Dansoman is going through challenges. We have called the contractor to come over for it to resolve it. Immediately we get answers, we put it across as to what is accounting for the challenges. And I think these are the few questions that have been, yes, that have to solve, yeah.
Ghana Health Service. Yeah, so Ghana Health Service, please join us.
Thank you very much, Honorable Minister. I think I'll take the first question. That is the number. You see, the 1,671, as you say, includes the very first case that was reported on the 11th of March. So whether you are in a hospital, you have recovered, you are in isolation, and as you claim have run away, you are part of that list. You remain the same in the very region where the case was identified. So every figure we are talking about is all who have tested positive, irrespective of the outcome. In the issue of the Bolga, I didn't hear the Bolga regional director make any statement. But remember, the website is yet to be updated. There are processes of validating report. I'm sure as journalists, when you file your report, you send it to your editor, isn't it? So these processes are done to validate the report before it's published on the website. Is there a repeat test? Is it confirmed, etc. before we put there. So what you should focus yourself is about what appears finally on the website. The Fadama case, I'm aware they've been found, and those in Tamale, they've also been found, and they are all in care. The backlog, yes, we still have some backlog, but as you can see, we've done almost 6,000 in a day. And we have not stopped sample collection, but we are working towards reducing the number of days that the gap opened, and there are plans to upscale our lab system, both in terms of the capacity of the individual labs and expanding new labs, creating new labs to be able to us to catch up on that. So it includes the backlog. I don't know whether the Minister of Health will answer the face mask, but let me ask. Let me try. I think we have used a lot of risk communication to explain to everybody the importance of wearing a face mask. And I believe that a significant number of people are applying. We are going to have to come up with audio and video clips that shows people exactly how to wear, how to remove, and how to maintain, and making sure that your mask covers your nose. So we are going to do all that, and I believe that the good people of Ghana will do that, follow. In countries where it's law, the enforcement is different. I'm sure if it becomes law, if it's necessary, the necessary actions will be done. But for now, it's a ministerial directive, and I'm happy that a lot of people are not only wearing it, but also making some business out of it to make sure everybody has access to glass. Thank you very much. Yes, there's been 5 new reported deaths. We are in the process of validating the source, and that is why we've not mentioned them. Some were dead on arrival among others. So we are validating. As soon as we do that, it will appear on the website, and everybody will know exactly where they have also come from. Thank you very much.
Thank you very much. The cost of the 88 hospitals. We are very early stages of reviewing our designs to fit purpose. And when that has not been completed, we can't do quantities. So I'll plead with the nation to wait a little bit. It won't take long. The cost will come out. We haven't completed that process yet. The police hospital in Accra. I've been explaining and talking, and it's like nobody is hearing me. We have about 5 different health service providers in this country. 2 big categories of public and private. So we have private sector people, those who have established their own hospitals. They are private. They have an association, and we work with them as one health service provider. We have what we call quasi-government institutions. So government organizations like Cocoa Board, Ports and Harbors, Bank of Ghana, the military are different, the security group. So the SNET, these are government institutions, but they own their own hospitals. Oversight is by their boards. It is a department in the organization. So their board and their management take charge of them. They employ their own doctors, they build their own facilities, they hire their own professionals into the service. So they provide service for their workers and their families, and in some instances for the public. So that is the quasi-government institutions. Then we have the securities hospitals, the police hospital, the military, I think the prisons even. All these security agencies have their own hospitals for some obvious reasons. Then we have the public ones, that is the Ghana Health Service, that provides close to about 70% of healthcare service in our country. Then we have the Christian Health Associations. Now, because the Islamic faith also established in hospitals, we in the ministry put them together as faith-based hospitals. The Islamic ones and the other Muslims, they are building hospitals now together with the Christians. Now, the Minister for Health oversights, then the teaching hospitals. I didn't mention that one. But that teaching hospitals are not part of Ghana Health Service. So the minister oversights the teaching hospitals and Ghana Health Service to the extent of their construction of their facilities, their employment, everything. But we play a complementary role with the Christian facilities, and in some instances even the security ones and the Christian institutions. If they need some technical advice from us, they will write to us and we go and assist them. So if you ask me about the police hospital in Accra, that question should have gone to the Minister for Interior. You see, when I was talking about the infrastructure, I was talking about the problems and things that we have with some of our contractors. So as I stand here, I may need to go and do some checks. Other than that, I will not be able to tell you the actual reasons why the hospital, the police hospital has stalled. Like General Hospital, we expect to complete the project in 24 months, and the cost is about 63 million euro. It includes the cost of demolishing and bringing it up with equipment to make it fit for purpose. I think this is about all the questions that came up, and thank you very much.
Minister, thank you. Let me call on Zoom Lion Ghana Limited that is here. I do understand you have a check. Please step forward very quickly so that we can receive that one. And then Maglin Industries, that has also got some products here. Zoom Lion. Honorable Deputy Minister for Works and Housing, you want to help me with this? Yes, sir. Please take it forward. This is a check for 100,000 Ghana cedis, I understand. 100,000 Ghana cedis from Zoom Lion Ghana Limited. We are grateful for your contribution. Thank you so much. And then Maglin Industries. Maglin Industries. Maglin Industries. Where are you? Please come here. Honorable Deputy Minister. Maglin Industries. You have products. So please put your products right here for us. Hand sanitizers and a few other products which will be made available to the frontline health workers across the value chain.
Firstly, water-based, and we are donating massive COVID every calendar. We expect that we spend
We are grateful. We are very grateful.
Some of the products, Cabinet Secretariat. Now also to the Ministry of Education. White. In place of white, just get it.
We are grateful. We are very grateful. We are very grateful for your contribution as well. Thank you very much, Maglin Industries Limited. Colleagues, we'll be winding down on today's press briefing. We are very grateful for your time and for the coverage that you have given us. The COVID-19 Relief Fund informs us to inform the general public through you. They have set up an office in the Jubilee House complex. There's an office for the COVID-19 Relief Fund in the Jubilee House complex, and they will be receiving all donations and support items there henceforth. So these will be the very final ones that we are receiving here. The COVID-19 Relief Fund will be receiving henceforth all donations and contributions at their office within the Jubilee House complex. Thank you very much for your time. Thursday, 9 a.m., we'll get you some more briefs. Thank you.